Welcome back to part 2 of my acne in 2022 video. If you saw last week's video, you'll be up to date with what's causing acne, why it's important right now, and in today's video, I want to get into what we're going to do about it, how to build that all essential plan. Now, we want to plan this because to fail to plan is to plan to fail, and we don't want that to happen today, guys. So I'm going to share with you how I approach breakouts in acne, something I've been doing for over 2 decades with my patients in my Harley Street clinic, and I want to share all my pearls of wisdom with you today. Now, we're focusing on the 3 components of an effective skincare routine. This video is simply going to cover skincare solutions today. For those who need more involved treatment, I have got other videos that I'll point you to in the comments below. Now, when it comes to those 3 components, it's simple. The first component is your non-clogging skincare basics. This is the foundation of an effective acne routine. And to embark on a routine without this is to plan to fail. It's that essential. So for me, it's as simple as cleanser, moisturizer, and sunscreen. No more elaborate than that. You might have some variation in how hydrating your moisturizers. You might have a lighter one for daytime and a richer one for nighttime, but that is it. I don't want any more confusion or complication than that. The next component of your routine is the fire extinguisher. So that's your anti-inflammatory active, and typically that resides in your morning routine. The final component, number 3, is your preventer. And that's the treatment that's going to stop those breakouts from happening in the future. We don't want just a routine that's going to correct what's happening today. We want one that's going to keep our skin clear and blemish-free for the future. So let's start with cleansing. Why is cleansing important when it comes to breakouts and acne? Well, the simple matter is that if you get cleansing wrong, it's very difficult to get your skincare routine right. And in studies that used overly harsh foaming cleansers, the acne was actually seen to worsen. So what we like to do is to stick to those that are kind to the skin barrier, because it turns out barrier function is incredibly important when it comes to planning a successful acne routine. My recommendation for the best approach to cleansing is to keep it simple and active free. I am a fan of the single cleanse, as many of you will know, and that's because uncomplicated cleansing is kind to skin barrier function. And we know that in putting together an effective breakouts routine, we are going to be using actives that might have a drying effect. Also, we know we're going to be using leave-on products. So I tend to say that cleansing should be active free. That minimizes the risk of irritation in the eye area and even the neck area. And it means that we are gearing up to dose our actives in a more precise way with our leave-on products. So cleansing, simple, single cleanse, non-foaming, kind to skin barrier function, non-clogging to pores. Really, that is the key to successful cleansing in context of breakouts. Now, when it comes to hydration, as I said, I think it is useful to have a good day's moisturizer when skin is calm, less dry, potentially is a little bit on the oilier side. So typically combination skin affects 60 to 65% of us. So that means drier here, potentially oilier here. Many people will prefer a lighter moisturizer for daytime in that context. But it's also useful to have something richer for nighttime, because typically we're using actives like retinoids that are going to be a bit drying. And at the beginning, as your skin becomes acclimatized to using active products, potentially 2 actives, morning and night, you're going to want to balance that with moisturizer, using it to buffer by applying it before your actives, and potentially using it, at night time as a mask to avoid overnight dryness. Now, you may ask why sunscreen is in an acne treatment plan. Well, the reality is that UV rays have the power to increase any pigmentation marks that your blemishes have left behind. So that's the first reason. And the second reason is they may promote comedogenesis. They may make the oils in the skin more prone to clogging up. So fundamentally, we are better off protecting our skin from UV rays with sunscreen, plus we're using retinoids, so the 2 go hand in hand. Now, Whilst you might have some fear around sunscreen use if historically you've experienced breakouts when you have perhaps used the wrong sunscreen, one that wasn't designed for breakout prone skin, the good news is there is lots to choose from now. Now, in terms of products for the basics, I've listed some great options in my acne cheat sheet, and I'm going to link to that in the description box down below. So you've got some options to look at for your cleanser, moisturizer and sunscreen, these foundations of an acne prone skin routine. Now, coming on to the exciting stuff, the actives. Let's start with the fire extinguisher. So the fire extinguisher is the group of active ingredients that calms inflammation. That's the stuff that's going to make a spot look better overnight, hopefully, if we're using something effective. So reducing the redness, reducing the swelling, reducing the discomfort of those big, sore, deep-seated ones that so many of us suffer, particularly around the time of your period. So the group of ingredients you can look at that have an anti-inflammatory function include benzoyl peroxide. I like to use this at no more than 2.5% strength. Over that doesn't tend to offer that much additional benefit and can be drying. I like salicylic acid at 1 to 2%, typically 2. Niacinamide at a percentage of 5 to 10% is very effective and kind to barrier function, so it's not particularly drying. That's really quite attractive as an ingredient profile. And in addition, topical antibiotics and azelaic acid will also have some anti-inflammatory properties too. Now, the good news is that some of those anti-inflammatory ingredients also have additional benefits. So for example, niacinamide is thought to reduce oil production, helpful. And salicylic acid is also useful in that it breaks down existing clogged pores, what we call a secondary comedolytic. It's also antibacterial as well. So what we find so often is active ingredients that really work have multiple benefits too, especially when we combine them. Now we come on to the preventer category. So the group of topical agents that will help stop you from breaking out in the future. Amen. Now, preventers are what we call primary comedolytics. Now, what that means is they stop those clogs from forming in the first place. And if the clogs don't form, we're very unlikely to break out. So they are fundamental to getting control of your skin and stopping breakouts in the future. Now, their impact isn't going to happen overnight. And in fact, hello, Hector. Something that unclogs your pores can sometimes lead to a phenomenon called purging. He doesn't like purging. Now, I've done a video on purging. This is something for anybody starting out on their acne journey for the first time to know about. It's something that can happen around the 2-week mark as those pores that are clogged unclog, and in a way they're kind of pushed through like they're on a little conveyor belt. So think of it as being the breakouts you were going to get over the next 6 months, slowly, blip, 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 happening over the course of 4 to 6 weeks instead. The good news is once those clogs are out, typically they stay unclogged. So it's kind of a cathartic thing, but oftentimes a sign that things are going in the right direction. There are two. We have our retinoids, the gold standard of treatment when it comes to acne, and we have azelaic acid, which is a fantastic dupe that I use most typically when someone is becoming pregnant and doesn't want to use retinoids. The main reason not to use a retinoid being that we don't tend to use them in someone who's trying to conceive or is pregnant. And that's because vitamin A is a signaling molecule in the developing fetus. Topicals are unlikely to have much of an impact on this, but we don't do this just to be on the safe side. Now, there's loads to say about both retinoids and azelaic acid. I would point you to my Retinoid Revelations series, where you can really geek out on retinoids and understand more about which one to choose, what to expect with using them, and some of my top hacks for ensuring that you have a successful retinoid experience. And I've also done lots of content around azelaic acid. I've kind of been a cheerleader for azelaic acid since I started on YouTube, and some of my most watched videos are on azelaic acid, so I'll link to a couple of those too. So now you have the correct tools. How do you use them? And this is something I am obsessed about because I recognize that historically, you don't get a lot of information on how to use these things correctly. So it's why I developed my 13-dot technique in order to help people treat the right areas of their skin correctly with the right dose of product. So typically with your preventer step, you want to treat the whole face. You want to reduce the risk of breakouts all over, but you also want those nice textural improvements you get from a retinoid. You might want the pore clearing effects of azelaic acid beyond the areas in which you're breaking out. Either way, your skin will just look better for using them all over. Hence the 13 dot technique. Now, if you're treating breakouts, you may want to focus your anti-inflammatory on the zones that you are predisposed to it. So I talk a lot about zoning your actives. So the zone might be the U of the face, or it might be the T zone. And then, as I said, the final aspect of getting your treatment to be applied correctly is to dose it. And I think the fingertip unit is the best way to do this. So whether you're starting out using half a fingertip, or whether you're more experienced, your skin has become tolerant and you're up to using a fingertip amount, measuring it and being consistent with usage is the best way to see results. Similarly, when you're starting out, you might want to apply product less frequently, so every other day or even every third day, and build up slowly to using products daily. As we said before, our milestones are in the order of months, so there's no rush to do things every day right at the beginning, and this will be so much kinder and more easy to tolerate long term. So in today's video, we've covered how to go about putting together an effective acne strategy, including your basics, your fire extinguisher, and your preventer. We've also talked about how best to apply these for maximum results and how to build a consistent routine that you can actually stick with over time. And let me tell you, it's never too late. I saw a patient in her 50s for the second time last week, and she was spot-free for the first time in her adult life. And she was delighted. She took as much joy as somebody in her teens or 20s might experience from getting clear skin. I'm with you on this journey and I want to help, so please let me know any questions that you have for me in the comments down below. I will link to other useful resources, the videos that I've produced in the past I think will help you. Let's do this together. Thank you for joining me today. Bye for now.